Calcium gluconate. Expanded lecture note. Welcome to our in-depth exploration of calcium gluconate, a crucial medication that's often the unsung hero in critical care situations. From cardiac arrest and magnesium toxicity to hypocalcemia and more, calcium gluconate plays a vital role in stabilizing heart rhythms, restoring electrolyte balance, and saving lives. In this lecture, we'll dive into the pharmacology, clinical uses, and essential nursing considerations for calcium gluconate, equipping you with the knowledge to provide top-notch care in high-stakes situations. Let's get started. Objectives. At the end of this lecture, students should be able to 1. Define and describe calcium gluconate. 2. Understand its classification, chemistry, and properties. 3. Explain its pharmacokinetics and pharmacodynamics. 4. Identify its clinical uses in medicine, anesthesia, and ICU. 5. Discuss side effects, contraindications, drug interactions, and overdose management. 6. Highlight its emergency uses and monitoring requirements. Names and formulations. 1. Generic name: calcium gluconate. This is the official name of the medication, which is commonly used in medical settings. 2. Chemical formula: CHSAO. This formula represents the chemical composition of calcium gluconate, indicating the presence of calcium and gluconate ions. 3. Brand names. CalG, one of the brand names under which calcium gluconate is marketed. Gluconate Cal, another brand name for calcium gluconate. Gluconate injection. Brand names may vary by region, but the formulation typically remains the same. 4. Variations in brand names may occur depending on the region or country where the medication is sold. Introduction to calcium gluconate. 1. Calcium gluconate is a calcium salt. It is a compound that contains calcium, an essential mineral for various bodily functions. 2. Used to treat or prevent calcium deficiency. Calcium gluconate is administered to patients low calcium levels or those at risk of developing calcium deficiency. 3. Less irritant than calcium chloride. Compared to other calcium salts like calcium chloride, calcium gluconate is less likely to cause irritation when administered intravenously. 4. Safer IV administration. Due to its lower irritancy, calcium gluconate is considered a safer option for intravenous administration. 5. Essential role in neuromuscular activity. Calcium plays a crucial role in muscle function and nerve transmission, affecting muscle contraction and relaxation. 6. Cardiac conduction. Calcium is necessary for proper heart function, helping regulate heart rhythm and contraction. 7. Blood coagulation. Calcium ions are required for the blood clotting process, helping to prevent excessive bleeding. 8. Bone metabolism. Calcium is vital for maintaining bone health, supporting bone growth and density. 9. Widely used in emergencies. Calcium gluconate is commonly used in critical situations, such as hypocalcemia, low calcium levels, hyperkalemia, high potassium levels, hypermagnesemia, high magnesium levels, calcium channel blocker overdose, to counteract the effects of the overdose. Debunking myths about calcium gluconate. 1. Myth: calcium gluconate and calcium chloride are the same. Fact: they are different. Calcium gluconate contains 9% elemental calcium, while calcium chloride contains 27% elemental calcium, making them distinct in terms of potency and use. Calcium gluconate is considered safer for peripheral IV administration due to its lower potency and reduced risk of tissue irritation. 2. Myth: calcium gluconate is only for bone health. Fact: its uses extend far beyond bone health. It is critical in emergency situations such as treating hyperkalemia and managing magnesium sulfate toxicity. Calcium gluconate plays a life-saving role as an antidote in magnesium sulfate toxicity, helping to rapidly reverse the effects of excessive magnesium levels. It is also used in other critical situations, such as calcium channel blocker overdose, where it helps restore normal cardiac function. Definition of calcium gluconate. Calcium gluconate is the gluconate salt of calcium, used as a mineral supplement and emergency drug for correcting acute symptomatic hypocalcemia, hyperkalemia, hypermagnesemia, and calcium channel blocker overdose. 1. Calcium gluconate is the gluconate salt of calcium. It is a compound that combines calcium with gluconic acid, making it suitable for medical use. 2. Used as a mineral supplement, calcium gluconate provides essential calcium to the body, supporting various physiological functions. 3. Emergency drug. It is used in critical situations to rapidly correct life-threatening conditions. 4. Correcting acute symptomatic hypocalcemia. Calcium gluconate is administered to treat low calcium levels that cause symptoms such as muscle cramps, or seizures. 5. Hyperkalemia. It helps stabilize cardiac membranes in cases of high potassium levels, reducing the risk of arrhythmias. 6. Hypermagnesemia. Calcium gluconate acts as an antidote to counteract the effects of excessive high magnesium levels. 7. Calcium channel blocker overdose. It is used to treat overdoses of calcium channel blockers, helping restore normal heart function and blood pressure. History of calcium gluconate. 1. Discovered in the early 20th century, calcium gluconate was developed as a safer alternative for intravenous administration of calcium. 2. Safer IV form of calcium compared to calcium chloride. Its discovery provided a less irritating option for delivering calcium intravenously, reducing the risk of tissue damage. 3. Added to WHO Essential Medicines list. The World Health Organization recognizes calcium gluconate as an essential medication due to its critical importance in emergency care. Or, critical emergency applications. Its inclusion on the WHO list highlights its vital role in treating life-threatening conditions such as hypocalcemia, hyperkalemia, and magnesium toxicity. Classification of calcium gluconate. 1. Pharmacological class. Calcium salt. Calcium gluconate belongs to the class of medications known as calcium salts, which are used to supplement or restore calcium levels in the body. 2. Therapeutic class. Electrolyte replacement. As an electrolyte replacement, calcium gluconate helps restore normal calcium levels, which are essential for various bodily functions. 3. Therapeutic class. Antidote. Calcium gluconate also serves as an antidote in specific situations, such as treating magnesium sulfate toxicity or calcium channel blocker overdose, by counteracting the effects of these conditions. Chemical properties of calcium gluconate. 1. Molecular formula. CHSAO. This formula indicates the composition of calcium gluconate, showing the arrangement of calcium, carbon, hydrogen, and oxygen atoms. 2. Molecular weight. 430.37 grams per mole. The molecular weight is the total mass of the atoms in a molecule of calcium gluconate. 3. Appearance. White crystalline or granular powder. Calcium gluconate typically appears as a white powder or crystalline solid. 4. Odorless, tasteless. It lacks a distinct smell or taste, which can be advantageous in medical applications. 5. Solubility. Freely soluble in water. Calcium gluconate dissolves easily in water, making it suitable for intravenous administration and other aqueous formulations. Physical properties of calcium gluconate. 1. Stable in dry form. Calcium gluconate remains stable when stored in a dry environment, maintaining its potency and effectiveness. 2. Available in oral and injectable forms. It can be administered orally for supplementation or intravenously for emergency situations or severe deficiencies. 3. IV solution. 10% calcium gluconate. This concentration indicates that 10 grams of calcium gluconate are dissolved in 100 milliliters of solution. 4. 1 gram milliliters. Each 10 milliliters of the 10% solution contains 1 gram of calcium gluconate. 5. 90 milligrams elemental calcium. Each 10 milliliters of the 10% solution provides 90 milligrams of elemental calcium, which is the active component that corrects calcium deficiencies. Mechanism of action of calcium gluconate. 1. Provides bioavailable calcium ions, Ca². Calcium gluconate supplies calcium ions that are readily available for use by the body. 2. Essential for neuromuscular transmission. Calcium ions facilitate release of neurotransmitters like acetylcholine, enabling nerve impulses to communicate with muscles. 3. Muscle contraction. Calcium is necessary for the contraction of skeletal, smooth, and cardiac muscles, supporting movement and organ function. 4. Cardiac conduction. Calcium ions play a critical role in the plateau phase of the cardiac action potential, helping regulate heart rhythm. 5. Blood coagulation cascade. Calcium is required for the proper functioning of the blood clotting process, helping to prevent excessive bleeding. 6. Bone mineralization. Calcium is essential for maintaining bone health, supporting bone growth, density, and structure. 7. In hyperkalemia, hypermagnesemia, calcium gluconate helps stabilize cardiac membranes, reducing the risk of arrhythmias and cardiac complications. 8. Stabilizes cardiac membranes. By counteracting the effects of high potassium or magnesium levels, calcium gluconate helps restore normal cardiac function and reduce the risk of life-threatening arrhythmias. Pharmacokinetics of calcium gluconate. 1. Absorption. Oral calcium gluconate is slowly absorbed. When taken orally, calcium gluconate is absorbed gradually, providing a sustained release of calcium. 2. IV form gives immediate effect. Intravenous administration of calcium gluconate produces rapid effects, making it ideal for emergency situations. 3. Distribution. 99% stored in bones, teeth. The majority of calcium in the body is stored in bones and teeth, where it supports structure and strength. 4. 1% in plasma, ECF. Ionized form is active. A small percentage of calcium is present in the bloodstream and extracellular fluid, where the ionized form is biologically active. 5. Metabolism. Not metabolized. Calcium gluconate is not broken down or metabolized by the body, it is used in its active form. 6. Excretion. Renal and fecal. Excess calcium is eliminated from the body through both the kidneys, urine, and the gastrointestinal tract, feces. 7. Onset. IV, immediate minutes. The effects of intravenous calcium gluconate are almost instantaneous, typically occurring within minutes. 8. Duration. 30 to 60 minutes. The effects of calcium gluconate last for approximately 30 to 60 minutes, depending on the dose and individual factors. Pharmacodynamics of calcium gluconate. 1. Restores normal serum calcium. Calcium gluconate helps to normalize calcium levels in the blood, which is essential for various bodily functions. 2. Stabilizes cardiac and neuromuscular membranes. By restoring normal calcium levels, calcium gluconate helps stabilize the membranes of cardiac and neuromuscular cells, reducing the risk of arrhythmias and muscle dysfunction. 3. Antagonizes toxic effects of hyperkalemia. Calcium gluconate counteracts the effects of high potassium levels, helping to stabilize cardiac membranes and reduce the risk of arrhythmias. 4. Antagonizes toxic effects of hypermagnesemia. It also counteracts the effects of high magnesium levels, which can cause cardiac and neuromuscular dysfunction. 5. Antagonists. Toxic effects of calcium channel blocker overdose. Calcium gluconate helps to reverse the effects of calcium channel blocker overdose by restoring normal calcium influx into cardiac and smooth muscle cells. Clinical uses of calcium gluconate. 1. Electrolyte replacement. Calcium gluconate is used to restore normal calcium levels in the body. 2. Hypocalcemia. It treats low calcium levels caused by conditions such as tetany, seizures, hypoparathyroidism, or vitamin D deficiency. 3. Emergency medicine (ICU). Calcium gluconate is critical in emergency situations, particularly in the intensive care unit. 4. Severe hyperkalemia. It stabilizes cardiac membranes in high potassium levels, reducing the risk of arrhythmias. 5. Severe hypermagnesemia. Calcium gluconate acts as an antidote to counteract the toxic effects of high magnesium levels, such as those caused by magnesium sulfate. 6. Calcium channel blocker overdose. It treats overdoses of medications like verapamil, diltiazem, and amlodipine by restoring normal calcium influx into cardiac and smooth muscle cells. 7. Obstetrics and gynecology. Calcium gluconate is used as an antidote for magnesium sulfate toxicity in eclampsia, helping to prevent complications. 8. Anesthesia and perioperative. It reverses hypotension or arrhythmias caused by hypocalcemia and manages transfusion-related hypocalcemia due to citrate toxicity. 9. Adjunct in severe allergic reactions, anaphylaxis. Calcium gluconate may be used as an adjunct treatment to support cardiovascular stability in severe allergic reactions. 10. Dietary calcium supplementation. The oral form of calcium gluconate is used to supplement dietary calcium intake, supporting bone health and overall physiological function. Dosage and administration of calcium gluconate. 1. IV emergency 10 ml of 10% solution. In emergency situations, 10 ml of a 10% calcium gluconate solution is administered intravenously. 2. 1 gram calcium equals 90 mg elemental calcium. Each 10 ml dose contains 1 gram of calcium gluconate, which provides 90 mg of elemental calcium. 3. Administered over 5 to 10 minutes. The IV dose is given slowly over 5 to 10 minutes to avoid adverse effects. 4. May repeat depending on indication. Additional doses may be administered based on the patient's condition and the underlying cause. 5. Oral supplementation 500 mg 2 grams daily. For calcium supplementation, oral doses range from 100 mg to 2 grams daily. 6. In divided doses, oral doses are typically divided throughout the day to maintain stable calcium levels. 7. Important. Give slow IV infusion. Right pointing arrow. Avoid arrhythmias. Slow administration is crucial to prevent arrhythmias and other cardiac complications. 8. Prefer central line if repeated doses needed. If multiple doses are required, a central line is preferred to minimize the risk of extravasation and tissue irritation. 9. Never give IM or SC. Right point arrow causes severe tissue necrosis. Calcium gluconate should never be administered intramuscularly (IM) or subcutaneously (SC) due to the high risk of severe tissue damage and necrosis. Side effects of calcium gluconate. 1. Flushing, sweating. Some patients may experience flushing or sweating due to the effects of calcium gluconate on blood vessels and circulation. 2. Nausea, vomiting. Gastrointestinal side effects like nausea and vomiting can occur, especially with rapid administration or high doses. 3. Hypotension. If rapid IV, rapid intravenous administration of calcium gluconate can cause a drop in blood pressure, leading to hypotension. 4. Arrhythmias, if rapid eye administration can also disrupt heart rhythm, potentially causing arrhythmias. 5. Extravasation leading to tissue necrosis. If calcium gluconate leaks into the surrounding tissue during IV administration, extravasation, it can cause severe tissue damage and necrosis. Contraindications for calcium gluconate. 1. Hypercalcemia. Calcium gluconate is contraindicated in patients with elevated calcium levels, as it can worsen hypercalcemia and lead to complications. 2. Severe renal calculi or renal failure with hyperemia. Patients with kidney stones or renal failure who also have high calcium levels should avoid calcium gluconate, as it can exacerbate these conditions. 3. Ventricular fibrillation during resuscitation. Calcium gluconate is generally not recommended during cardiac resuscitation. Patient is in ventricular fibrillation, as it may worsen cardiac function. 4. Patients on digitalis digoxin, leading to risk of toxicity. Calcium gluconate can increase the risk of digitalis toxicity in patients taking digoxin, potentially leading to life-threatening arrhythmias. Precautions for calcium gluconate administration. 1. Use cautiously in renal impairment. Patients with kidney impairment are at higher risk of developing hypercalcemia, so calcium gluconate should be used with caution in these individuals. 2. Avoid rapid IV push. Rapid administration can cause adverse effects such as hypotension and arrhythmias, so calcium gluconate should be given slowly. 3. Continuous ECG monitoring during IV administration. Continuous monitoring of the electrocardiogram, ECG, is recommended during IV administration to detect any potential cardiac complications. 4. Separate line from bicarbonates or phosphates leading to precipitation risk. Calcium gluconate should be administered through a separate line from solutions containing bicarbonates or phosphates, as mixing them can cause precipitation, compromise the effectiveness of the medication. Drug interactions with calcium gluconate. 1. Digitalis glycosides digoxin. Calcium gluconate can increase the risk of fatal arrhythmias when used with digoxin, as both medications affect heart function and can potentiate each other's effects. 2. Calcium channel blockers. Calcium gluconate reduces the effectiveness of calcium channel blockers by counteracting their calcium blocking action, potentially leading to increased heart rate or blood pressure. 3. Phosphates bicarbonates. Mixing calcium gluconate with phosphates or bicarbonates in an IV can cause precipitation, which can obstruct the line and reduce the medication's effectiveness. 4. Thiazide diuretics. Thiazide diuretics can increase the risk of hypercalcemia when used with calcium gluconate, as they reduce calcium excretion in the urine, potentially leading to elevated calcium levels. Toxicity and overdose management of calcium gluconate. 1. Signs of toxicity, overdose. Symptoms can include nausea, vomiting, constipation, confusion, muscle weakness, arrhythmias, and in severe cases, cardiac arrest. 2. Management. Stop calcium gluconate. The first step in managing an overdose is to discontinue administration of calcium gluconate. 3. IV loop diuretics plus saline. Administering IV loop diuretics along with saline can help enhance calcium excretion through the kidneys, reducing levels in the body. 4. Dialysis if severe. In cases of severe overdose, dialysis may be necessary to rapidly remove excess calcium from the bloodstream and prevent further complications. Storage and disposal of calcium gluconate. 1. Store at 20 to 25 degrees Celsius, away from light. Calcium gluconate should be stored at room temperature, between 20 to 25 degrees Celsius, and protected from light to maintain its stability and effectiveness. 2. Use only clear solutions. Before administration, ensure the solution is clear and free of any visible particles or precipitates, as cloudy or discolored solutions may indicate degradation or contamination. 3. Do not mix with phosphate or bicarbonate containing IV fluid. Mixing calcium gluconate with IV fluids containing phosphates or bicarbonates can cause precipitation, rendering the solution ineffective or causing complications. 4. Dispose per biomedical waste protocols. Dispose of unused or expired calcium gluconate and related material according to established biomedical waste protocols to ensure safe and environmentally responsible disposal. Nursing clinical management of calcium gluconate. 1. Monitor serum calcium, ECG, BP during IV infusion. Continuous monitoring of serum calcium levels, electrocardiogram, ECG, and blood pressure is essential during IV administration to detect potential complications. 2. Ensure IV line patency, avoid extravasation. It is crucial to ensure the IV line is patent and functioning properly to avoid extravasation, which can cause tissue damage and necrosis. 3. Educate patients on oral calcium meals for better absorption. Patients should be advised to take oral calcium supplements with meals to enhance absorption and minimize gastrointestinal side effects. 4. Keep resuscitation equipment ready during emergency use. When administering calcium gluconate in emergency situations, it is essential to have resuscitation equipment readily available to manage any potential adverse reactions or complications. Use of calcium gluconate in ICU. 1. Stabilizes myocardium in hyperkalemia. Calcium gluconate is used in the ICU to stabilize the myocardium in patients with high potassium levels, reducing the risk of life-threatening arrhythmias. 2. Treats transfusion-related hypocalcemia, citrate toxicity. It is used to treat low calcium levels caused by citrate toxicity, which can occur during massive blood transfusions. 3. Antidote for magnesium toxicity. Calcium gluconate acts as an antidote for magnesium toxicity, helping to counteract the effects of excessive magnesium levels on the heart and nervous system. 4. Calcium channel blocker overdose. It is also used to treat overdoses of calcium channel blockers, helping to restore normal cardiac function by increasing calcium influx into cardiac and smooth muscle cells. Use of calcium gluconate in anesthesia. 1. Correction of perioperative hypocalcemia. Calcium gluconate is used to correct low calcium levels that may occur during the perioperative period, ensuring stable cardiac and neuromuscular function. 2. Prevention treatment of citrate-induced hypocalcemia during massive transfusion. It is administered to prevent or treat low calcium levels caused by citrate toxicity, which can occur during massive blood transfusions. 3. Management of arrhythmias associated with electrolyte imbalance. Calcium gluconate helps manage arrhythmias that arise from electrolyte imbalances, particularly those related to calcium levels, ensuring stable cardiac function during anesthesia. Use of calcium gluconate in emergencies. 1. First-line antidote for hyperkalemia with ECG changes. Calcium gluconate is a first-line treatment for hyperkalemia that has caused ECG changes, helping to rapidly stabilize cardiac membranes and prevent life-threatening arrhythmias. 2. Antidote for MgSO toxicity. It serves as an antidote for magnesium sulfate toxicity, counteracting the effects of excessive magnesium on the heart and nervous system. 3. Emergency drug in calcium channel blocker overdose. Calcium gluconate is used in emergency situations to treat overdoses of calcium channel blockers, helping to restore normal cardiac function. 4. Life-saving in citrate toxicity during transfusion. It can be life-saving in cases of citrate toxicity during massive blood transfusions, rapidly correcting low calcium levels and preventing cardiac complications. Comparison of calcium salts. 1. Calcium gluconate. Elemental calcium content, 9%. Common uses. Treatment of mild to moderate hypocalcemia, antidote for magnesium sulfate toxicity, and emergency situations where mild hypocalcemia needs correction. Special notes: less irritating to veins, making it safer for IV administration through peripheral lines. 2. Calcium chloride. Elemental calcium content, 27%. Common uses: treatment of severe hypocalcemia, cardiac arrest, hyperkalemia, and calcium channel blocker overdose. Special notes: more potent than calcium gluconate but highly irritating to tissues, requiring administration through a central line to avoid extravasation and tissue damage. 3. Calcium lactate. Elemental calcium content, 13%. Common uses: oral supplementation for dietary calcium deficiency. Special notes: well tolerated orally, making it a good option for patients who need calcium supplements in a less irritating form. 4. Calcium carbonate. Elemental calcium content, 40%. Common uses: common oral supplement for calcium deficiency and as an antacid. Special notes: not suitable for acute IV use. Can cause gastrointestinal side effects like constipation, but it is effective for long-term calcium supplementation. 5. Calcium citrate. Elemental calcium content, 21%. Common uses: oral supplement, particularly beneficial for elderly patients or those with achlorhydria, stomach acid. Special notes: preferred in osteoporosis prevention due to better absorption in certain patient populations, making it a good option for long-term calcium support. ECG changes in calcium disorders. 1. Hypocalcemia. In cases of low calcium levels, ECG changes can include prolonged QT interval. This can increase the risk of serious arrhythmias. Risk of torsades de pointes, a specific type of abnormal heart rhythm that can be life-threatening if not treated promptly. 2. Hypercalcemia. In cases of high calcium levels, ECG changes can include shortened QT interval. This reflects the effect of calcium on the heart's electrical activity. Bradycardia, a slower than normal heart rate. AV block, a delay or blockage in the electrical signals between the heart's chambers. Arrhythmias, abnormal heart rhythms that can range from mild to life-threatening. Calcium gluconate. Quick revision. Drug details. Drug: calcium gluconate. Class: calcium salt, electrolyte supplement. Mechanism of action: supplies calcium ions to restore neuromuscular excitability and stabilize cardiac membranes. Pharmacokinetics. Absorption: oral absorption is variable, while IV administration provides immediate effects. Distribution: calcium is distributed in extracellular fluid and stored in bones and teeth. Excretion: primarily excreted through the kidneys. Clinical uses: treatment of hypocalcemia and tetany. Antidote for magnesium sulfate (MgSO) toxicity. Management of hyperkalemia and calcium channel blocker overdose. Use in cardiac resuscitation. Dosage: IV, 10 ml of 10% solution, approximately 90 mg elemental calcium, administered slowly over 10 minutes. Oral, 1 to 3 grams per day. Side effects: arrhythmias, vasodilation, hypotension, tissue necrosis if extravasation occurs. Contraindications: hypercalcemia, renal stones, ventricular fibrillation, digoxin therapy. Drug interactions: digoxin increases the risk of toxicity. Tetracyclines decreases their absorption. Bisphosphonates may interact with calcium gluconate. IV bicarbonate can cause precipitation. Toxicity: signs: nausea, vomiting, constipation, polyuria, confusion, and arrhythmias. Management: stop calcium gluconate administration, IV fluids, loop diuretics, and bisphosphonates in severe cases. Use in specific settings. Anesthesia. Stabilizes myocardium and is useful in MGSO toxicity during eclampsia. ICU. Management of hypocalcemia and hyperkalemia emergencies. Emergency use. Antidote for MGSO toxicity and calcium channel blocker overdose. Precautions. Administer IV slowly. Monitor ECG during administration. Avoid co-administration with bicarbonate or phosphate solutions to prevent precipitation. Key clinical pearls for calcium gluconate. 1. Calcium gluconate is safer than calcium chloride for IV use. This is because calcium gluconate is less likely to cause tissue necrosis if extravasation occurs, making it a better option for peripheral IV administration. 2. Always administer slowly. 10 ml over is greater than or equal to 10 minutes. Slow administration is crucial to avoid causing arrhythmias and other cardiac complications. 3. Check serum calcium and magnesium before and after giving. Monitoring these levels helps ensure that the treatment is effective and that calcium levels do not become too high or too low. 4. In hyperkalemia, calcium does not lower K. Instead, it stabilizes the cardiac membrane, reducing the risk of life-threatening arrhythmias caused by high potassium levels. 5. Do not mix with sodium bicarbonate in the same line. Mixing calcium gluconate with sodium bicarbonate can cause precipitate formation, which can obstruct the IV line and compromise the effectiveness of the treatment. OSCE exam tip questions for calcium gluconate. 1. What is the antidote for magnesium sulfate toxicity? 10 ml of 10% calcium gluconate IV slowly over 10 minutes. This helps counteract the toxic effects of magnesium sulfate on the nervous system and muscles. 2. Why is calcium gluconate preferred over calcium chloride for peripheral IV use? Calcium gluconate is less irritating and safer for peripheral IV use because calcium chloride can cause severe phlebitis and tissue necrosis if extravasation occurs. 3. What is the earliest ECG change in hypocalcemia? Prolonged QT interval. This is a key indicator of low calcium levels affecting the heart's electrical activity and can increase the risk of arrhythmias. 4. What is the difference between calcium gluconate and calcium chloride? Potency. Calcium chloride contains about 3 times more elemental calcium than calcium gluconate. However, calcium chloride is more irritating and requires administration through a central line to minimize the risk of tissue damage. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.